Francisco Mayor London Breed, and I am joined here by a number of departments who will be talking later on during this press conference. We are joined by Department of Emergency Management Director Mary Ellen Carroll, as well as Department of Public Health Director Dr. Grant Colfax, the Director of Human Services, Trent Rohr, the Director of Homeless Services for the city, Abigail Stewart-Kahn, and our Police Chief, Bill Scott. We have a pretty lengthy press conference today because we have a lot of information to update the public with. So I want to first start with City Test SF. And we know that every single day there are people who are working, city employees who are on the front lines. Our police officers, our firefighters, our muni drivers, our healthcare workers, they are essential city workers who are showing up and who are interacting with the public more so than most others. And they have, we know, concerns about their own health. So they can't always, in their capacity, practice social distancing. They are taking care of us, so it's important that we take care of them. And one of the most basic things that we can do is to ensure that they have access to testing. Now, last week, we announced a partnership that would allow our first responders to get priority testing through a number of healthcare providers. And here in San Francisco, we know that it's been very frustrating because we have lacked the testing that we need in order to really put people at ease and ensure them that they are safe. This means that so many of our workers have a lot of uncertainty. And uncertain if that they're exposed or that they have the virus. And that's why it's important that we do everything we can to ramp up locally, but to provide an option for them to be tested. Today, we are proud to announce that we are opening City Test SF, which will serve as a drive-through testing site for our frontline city workers. It'll be located at Piers 30 and 32. And we will be able to ramp up to test hundreds of city workers each and every day. And I really want to thank the companies Color and Carbon Health for partnering with us to undertake this incredibly important project. This has really been a team effort, and I especially want to thank the Port of San Francisco, the Director Elaine Forbes, as well as Dr. Grant Colfax and the Department of Public Health for their work in making this happen. The initial focus will be on first responders that I mentioned earlier, and as we ramp up, we will begin to expand it for some of our shelter workers and nonprofit workers and those other essential workers that are also on the front lines. Access to the expanded testing means that frontline staff who have become infected can be identified earlier and get the care that they need. It also means that frontline workers who are currently in quarantine but are not infected can return to their families and keep doing the critical work that we need them to do. They are taking care of us, as I said, so it's important that we do everything we can to take care of them. We also have been working to secure hotel rooms for our first responders, and today I'm proud to announce that because a collaboration between our Emergency Operations Center and the Hotel Council, we've secured our first hotel lease agreement to provide rooms for our frontline workers. With more rooms on the way. The first hotel property will provide 383 rooms for city frontline healthcare workers, people who work at General Hospital, or people who work at Laguna Honda. We anticipate finalizing a second hotel location this week for an additional 500 rooms. This weekend, 30 healthcare workers moved into the first hotels. These hotel rooms allow people to do the incredible work they are doing to save lives without having to worry about going home to infect their families or folks in their community. They provide the relief for frontline personnel who are working long hours and commuting far distances. And we will continue to add more hotel rooms for our frontline workers as well as for our other priorities, which include COVID-19 patients who need to be isolated but don't need to be in the hospital, and our vulnerable seniors and people with underlying health conditions in our shelters and on our streets. Today, we announced that we had 2 positive COVID-19 cases at one of the shelters. And Abigail Stewart-Kahn from the Department of Homelessness and Supportive Housing will discuss that in more detail. These hotel rooms are essential in our work to proactively move vulnerable people out of our shelters, as well as to quickly get impacted people into isolation when cases do occur. And we will continue to add more rooms as we continue to prepare our city for a potential surge at our hospitals. We also learned today that 2 individuals who tested positive for COVID-19 at MSC South have been in contact with 19 residents who had so far moved into the new location at Moscone West. All 19 individuals at Moscone West are being moved into quarantine into hotels as a precautionary measure. And we also realize that as things move quickly, although that we set up Moscone West initially to assist in thinning out many of our shelters throughout San Francisco to practice social distancing. And to be clear, Moscone West does meet CDC guidelines for providing shelters to those who do not carry the virus. We also realize that we need to think about making changes to avoid having an outbreak or situation in places like Moscone West or any place else where we know there are large populations of people, regardless of our CDC guidelines being implemented. Moving forward, as a result, we have made some changes to Moscone West. The Moscone West facility will now be used to house people who have been in quarantine and recovered from COVID-19, or people who had been quarantined and test negative for COVID-19. This will allow us to free up hotel rooms we don't have when people no longer need them. Just as the hotel rooms provide an exit for people from hospitals and shelters when someone needs to be quarantined, Moscone West can free up a space in the hotel when they no longer need to be isolated. And we're also going to be making some changes at Moscone West, including decreasing the capacity so we can allow people to spread out even more, adding partitions, and a lot more. We already have 24-hour bathroom attendants. We have shower facilities. We have outdoor locations and places for people to go outside and smoke cigarettes because we have people who live in our shelters who smoke cigarettes. We are thinking about food and where they eat and how we continue to keep those places clean. A number of adjustments will be made, and Trent will talk a little bit more about that. In addition to more hotel rooms to create space in our system, we need more hospital beds. In places like New York and Italy, we have seen what happens when we don't have enough of the facilities and equipment we need to handle the surge as we have talked about. We have seen overcrowded hospitals and doctors making choices about who to treat. We never want to get there in San Francisco, and we have to do everything we can to protect public health, but to make sure that when people need a doctor, when they need a hospital bed, that we don't turn them away. Today, Governor Gavin Newsom announced that the state will be leading an effort to open up 290 beds at the CPMC Pacific campus on California Street. We have been in close contact with the governor's office, with Sutter and CPMC on this issue over the past couple of weeks, and we are deeply appreciative of this effort to expand our hospital capacity. And we look forward to working with the governor and CPMC and Sutter to make sure that we have the capacity, that we are fully staffed with the equipment and the resources that we need to make sure that this hospital is able to support the people that we know need it the most. All along that we have said that no local jurisdiction can do this alone. We need support from the state and the federal government, and I'm truly grateful to the governor for his leadership in getting this site up and running. And we'll continue to need the state's support as we work together, as I said, to plan for staffing of the facility. Again, I want to thank Sutter and CPMC for their work in helping us expand our capacity. The site will need some minor improvements before it's operational, but we anticipate opening it within the next 10 days. Along with the 48 COVID-19 beds that opened at St. Francis Hospital today, we are continuing to do the work to prepare our medical system for the surge we all know is coming. Our entire medical system is united and focused on doing what it takes to get through what is an incredibly challenging time. And we are truly showing that when we come together, we can really deliver for the people of this city. I also want to provide an update with Muni, and we have the director, Jeff Tumlin of SFMTA, to provide more details. We know that there are going to be some changes with Muni and the bus service in the coming days, and that's why it's critical we get this City Test SF site up and running. Once the site is fully implemented, we'll be able to provide tests for Muni drivers so that if they have questions about whether any illness they may feel could be COVID-19 related, they will be able to get immediately tested. We need to give our drivers that certainty. If they are sick, they should stay home and seek medical care. If they are not, they can help keep our critical public transportation system running. But right now, one of the main reasons why we have had to reduce our service has a lot to do with a lot of uncertainty around testing and around keeping our Muni drivers safe. So this is why this is so critical and so important. These drivers work really hard for us. They are people who are out there every single day. They are essential workers to our workforce. And people who do not need to use Muni, please don't. And I know that Director Tumlin mentioned that before. This is the last thing that we want to say, but we want to make sure that people who need Muni the most have access to Muni. Buses have been crowded when they shouldn't be. And what that means is we're going to have to make some major changes to ensure public safety. And what we're asking the public to do is use common sense. If you see that a bus is crowded and you can't necessarily practice social distancing, do not get on the bus. If it gets too crowded, exit the bus. The fact is, we don't want to reduce service any further than we need to. We don't want a Muni driver to have to stop moving its bus because it is too crowded to move because the people on the bus are not practicing social distancing. So we need to take steps to keep our drivers safe and to keep the people who rely on Muni safe as well. I want to say a special, again, thank you to all the drivers out there. More than ever, you are so essential to us, and we will do everything we can to keep you safe. And so, busy times in our city, a lot of real challenges, and again, this weekend, I want to thank people here in San Francisco for continuing to practice social distancing, for just really taking the order seriously, although we know we continue to face a number of challenges in particular areas throughout the city. We have been very active out there with our police department, with our homeless outreach team and others to try to continue to educate people, but also hold them accountable because we are all connected. We all need to make better decisions about how we continue to implement social distancing as time goes on. It's going to be harder and harder for us to stay at home and continue this practice, but we are counting on all of you to participate, all of you to maintain social distancing, and everyone here in the city to look out for one another as we continue to get through this very challenging time. So at this time, I'd like to ask the Director of the Department of Public Health, Dr. Grant Colfax, to come up and provide us with an update from Public Health. Dr. Colfax.
Thank you, Mayor. I am Grant Colfax, Director of Health. Today, I want to thank everyone in San Francisco and in the Bay Area region for their cooperation and everything they are doing to help fight the spread of the coronavirus. You are leading the way. When you stay home, when you keep 6 feet apart from people, when you wash your hands, and when you cover your nose and your mouth with cloth, you are literally saving lives. I would like to update San Franciscans today on a few developments in our ongoing work to respond to the coronavirus and protect our community. Today, there are 583 San Francisco residents with confirmed cases of coronavirus. 83 of them are in the hospitals across the city, and nearly half of those 83 are in the intensive care units. We know that 3 of the confirmed cases are among people experiencing homelessness, including 2 at the MSC South Shelter and 1 who spent time at the Division Circle Navigation Center. This underscores the need for us to continue to focus on the most vulnerable populations, including those in long-term care facilities, shelters, people over 60, and those with underlying health conditions. Sadly, 9 San Franciscans have died from the disease, COVID-19. I would like to send condolences on behalf of the entire health department to their families, loved ones, and friends. And as we continue to fight the coronavirus pandemic, I would like to remind you that our top priorities continue to be slowing and reducing the spread of the virus in our community, protecting vulnerable populations, healthcare workers, and first responders, preparing our healthcare system for an expected surge of hospital patients, and expanding testing capacity. In all this work, we will continually seek to do better as we incorporate the latest science, data, and facts into our actions and recommendations. We have all known from the start that this is a rapidly evolving situation, and that will continue to be true. We will adapt our response accordingly. We are working quickly to integrate new information all the time and adjust our recommendations so that we are providing the very best and most up-to-date advice that we can give. As San Franciscans know, we are working to prepare our hospitals and health system for an expected surge of coronavirus patients. We have seen this happen in many places across the world and this country, and we need to be as ready as we possibly can. We are making progress in surge preparation, and I would like to share a few highlights today. As San Franciscans know, our surge capacity continues to increase, and today we have reached a significant milestone. We have successfully expanded our bed inventory system and exceeded the state's ask that all jurisdictions expand their capacity by at least 40%. By working together since January, San Francisco hospitals have managed to increase the city's intensive care unit beds from 277 to 530, a 91% increase, a 91% increase. And our regular acute care beds, so-called medical surgery beds, have increased from 1,055 to just over 1,600, a 52% increase. We accomplished this by opening previously closed units and by repurposing areas normally used for other functions, such as outpatient surgery. These extra beds will make a big difference. However, there are still plausible scenarios that a large surge could overwhelm even those additional resources. And yet, we have made progress by decompressing hospitals so they can be as empty as possible and ready for the surge. And we have canceled, by health order, elective surgeries and routine procedures. I am happy to report that today, St. Francis Memorial Hospital plans to open its newly dedicated unit for coronavirus patients. This unit will have a capacity eventually of 48 additional beds, including 8 intensive care unit beds. Additionally, with partners across the city, we have moved 150 patients who have confirmed coronavirus or who are awaiting test results, but who do not need hospital care, into hotels where they can safely isolate. We have also sped up testing so that patients have a shorter wait time for their results. There are several other surge plans in progress, including expanding clinics throughout the city, that we will be able to provide more information about soon. In addition, as the mayor mentioned and the governor announced today, the state has reached an agreement with CPMC to make its vacant Pacific Campus Hospital available for our coronavirus surge work. These additional beds are not included in the totals I just covered. Every day that we can prepare is a good day. It is so important that people continue to stay at home and to practice physical distancing, hand washing, and face covering. That is how we will slow down the virus as much as possible and ensure as much as possible that we have the beds we need in our hospital system to care for those most in need. Now I would like to talk briefly about data. As I have said many times, San Francisco's response to the coronavirus emergency is grounded and will continue to be grounded in data, science, and facts. We are able to use what we know from other parts of the world and the country to guide our decisions and inform our interventions. Data is and will always be an important tool to help San Franciscans see the whole picture of the coronavirus pandemic in our community. This knowledge can help us all do our part and see over time how the situation is changing. So today, I am pleased to announce that we will be sharing more data about San Francisco's coronavirus pandemic. Our data analysts have been working hard to collect information from across the city to create accurate, reliable, and timely reports to help guide our decisions and inform you, the public. DPH has been working and will continue to work with the Controller's Office and the Department of Emergency Management on a new data tracker that will be posted on our website very soon. The tracker will feature more information about cases, the demographics of patients, hospitalizations, and testing. We will add more data elements as we gather more information and continue to improve. Now, I would like to provide an update on the outbreak at Laguna Honda Hospital and the steps we are taking to protect the health of residents and staff. This weekend, we identified 4 new positive cases at Laguna Honda Hospital, bringing the total number of cases up to 16. 12 of the confirmed cases are among staff, and 4 are among residents. Of staff, 9 have been in patient care positions, and 3 have not. The 4 new cases are from an impacted unit, the South 5 neighborhood. 2 are residents of the South 5 neighborhood, and 2 are patient caregivers on the South 5 neighborhood. With regard to testing at Laguna Honda, to date, 290 staff have been tested, either directly by the Department of Public Health or their own provider. 98 patients at Laguna Honda Hospital have been tested. This weekend, we completed retesting of all patients on the South 5 neighborhood. Results are pending. The retesting of South 5 staff is happening today. We will also retest the staff and test all patients on South 4. To date, South 4 has no residents who have tested positive for coronavirus, though of course that situation could change. As part of our ongoing outbreak response, we continue to test staff and patients throughout the hospital that have been identified as being exposed through contact investigation or who show symptoms of the virus. Unfortunately, we do expect more positive cases, but it is crucial that we know the facts so that we can take evidence-informed action to preserve health and mitigate the spread of the virus in that institution. We are continuing to work very closely with the Centers for Disease Control and Prevention, who have been at Laguna Honda for the past week. They are joining our team of some of the world's foremost experts here in the San Francisco Department of Health and at UCSF to guide and inform our response. I am thankful for the support and expertise of our federal, state, and local partners in our response. And the CDC has recommended, and we have rapidly adopted, multiple infection prevention and control strategies to combat the coronavirus at the facility. These include limiting movement throughout the hospital to only essential movement, restricting accesses to 2 entrances only, where all staff is screened upon entering the hospital. There is mandatory masking for all staff, and there is enhanced personal protective equipment, or PPE, that is being provided for staff who are in quarantined or isolated areas or treating isolated patients. These are in addition to the steps that the Department of Public Health, with the support of Mayor Breed, has already taken to limit the spread, including placing the entire Laguna Honda community under a preventative quarantine. This prevents community spread by having residents remain on campus and limits opportunities for the virus to be brought on campus. We have stopped the rotation of staff to various units and limited impacted areas to only the most essential personnel. We have made the very hard but necessary decision in early March to restrict visitors at the site. At our request, the CDC and the State Health Department have provided additional clinical and epidemiologic leadership and support and strengthen our approach, including the contact investigations. And we will continue to test staff and residents based on these risk assessments going forward. The CDC is also providing expert knowledge to our clinical teams on improving the collection of data. This will not only inform prevention and response strategies for Laguna Honda Hospital, but also for skilled nursing facilities throughout the Bay Area and perhaps even the nation. Laguna Honda is and continues to be a top priority for the health department and the city. We and I will continue to do everything we can to respond to the changing situation, and I will keep the staff, residents, families, and public updated. Now I'd like to move to first responder testing and a brief mention of the hotels that Director Rohr will talk about. As we all know, health workers and first responders are crucial to San Francisco's battle against coronavirus. I am grateful to Mayor Breed, the Port, our DPH staff, and our private sector partners for creating the new testing site for healthcare workers and first responders. These talented and dedicated professionals are courageously working on the front lines every day. By providing them dedicated testing, we can assuage anxiety, answer uncertainty, and speed their recovery so that these first responders can be with their families and continue to support the health of our city. Now, Director Trent Rohr of the Human Service Agency will provide an update on another key aspect of supporting our health workers and first responders, temporary housing in hotels to keep them and their families safe. Thank you very much.
Good afternoon. I'm Trent Rohr. I'm the director of the Human Services Agency. Thank you, Dr. Colfax, for teeing up my discussion about first responder hotels. So we knew from the beginning of this that we were going to need to accommodate our frontline health responders, our healthcare workers, our nurses, our doctors. It's critically important that they be able to remain here and not potentially infect their families or others going back home. Many of our health responders have very long commutes after working very long shifts. In addition, we don't want health responders going home and potentially being infected in their communities. So to this end, we have secured 2 hotels, totaling 883 rooms for this purpose. The first 383-room hotel is currently under contract and will receive healthcare responders immediately. The second has already opened up 150 of their rooms, of which 30 were occupied over the weekend by the first group of health responders who took advantage of these hotels. We'll continue to identify hotels for this population should the need grow. Again, right now it's 883 rooms. And we continue to assess both the numbers of healthcare workers, nurses, doctors, and others, plus other critical first responders, medical social workers, law enforcement, to see what the numbers need to be. There are 2 other areas I'd like to address today. One is our shelters, particularly the shelter activation at Moscone West. And the second is an update on the hotel rooms we have secured for individuals who need to be quarantined, isolated, or protected from other congregate areas. So last week we announced the opening of the Moscone West Convention Center to serve as a shelter for 394 people to be able to thin out our existing shelter system. If you remember 4 weeks ago when we activated our operations center, we were using the best data and information at the time and continue to create and design our system using the best information available. We also said 4 weeks ago that this is a very fluid situation and will continue to be. The CDC at the time recommended that shelters achieve thinning of 3 feet between beds. Subsequent to that, the State Department of Health increased that to 6 feet between beds. And the latest from the state of California, as well as other counties, are now shifting gears away from congregate sites entirely and moving towards hotel rooms. So to this end, we are now shifting gears at Moscone West, and rather than that being a shelter to achieve the reduced population in our homeless shelter system, that will instead serve as a shelter environment for individuals who have either tested negative for COVID-19 or who are considered post-COVID or have cleared the 14 days and are no longer COVID positive. This will be staffed by the appropriate medical and social work staff. The population will be reduced from a total of 394 down to 200. The shelter will be partitioned off into 4 areas of 50 patients each, and each individual will have their own partition, creating that necessary physical distance as well as a wall or partition to create additional privacy. This will help us really provide a relief valve on the back end of our system, allowing individuals who were quarantined in hotel rooms to exit out after having been, again, tested and tested negative, to allow for those rooms then to be activated for additional people who need to be quarantined. It will also help our hospital system for homeless individuals who may be in that system for a non-COVID related illness. Those individuals also will have been cleared by the hospital and could choose to go to that shelter as well. We still have the imperative, however, of reducing the populations in our existing shelter system. The plan moving forward now is to achieve this reduction through placement into hotel rooms exclusively. We will continue to focus on the population in our shelters, individuals age 60 and above, as well as individuals who have underlying health conditions that make them more vulnerable to COVID. The current estimate of the number of rooms in order to achieve that reduction in shelter census is 500, which brings me to the data on the hotel rooms that we have brought forth up to the present. We currently have 945 rooms in 8 hotels across the city to be able to receive individuals who either need to be quarantined or isolated, or individuals who are going to be moved from the shelter system in order to reduce the population, or moved from the street. The individuals who are moving from the street, again, per the CDC guidelines, per the FEMA reimbursement guidelines, would be individuals who are over age 60, or individuals who have underlying health conditions that make them vulnerable or more vulnerable to the COVID-19 virus. We continue to move individuals as we speak. So far, we have moved or admitted over 150 individuals into these rooms, with another 40 vulnerable adults being moved from the shelter system today. We will continue to do 2 things. One is continue to move individuals from the shelter system and then the street into these rooms, but we also continue to work with hotel owners and negotiate further contracts to bring additional rooms online. Again, when we started this 4 weeks ago, based on the best guidance from the CDC and from our partners at the State Department of Health, as well as the Department of Public Health here in San Francisco, our target was 3,500 hotel rooms and 2,500 shelter beds. Based on the best information, evidence, and data we have now, we're looking at more like 4,500 hotel rooms, and the shelters that we had planned to activate to create thinning are now no longer going to be used for that purpose. Moving forward, we are working with our public health partners to identify potentially smaller congregate sites to serve as medically based shelters, and this would be for individuals who are vulnerable, or older and need extra support that cannot be provided within the confines of a hotel room. The lead on our movement out of the shelter system into hotels, as well as the identification of vulnerable individuals on the street and moving into hotels, is led by the Department of Homelessness and Supportive Housing. The director of that department, Abigail Stewart-Kahn, is here to talk about how we're going to achieve that reduction in our shelters and on the streets, as well as to talk to you about our system response to the COVID positive identification at Division Circle Navigation Center, as well as at our MSC South homeless shelter. So Abigail Stewart-Kahn.
Thank you, Director Rohr. Thank you, Mayor Breed, and to the guests, HSH staff, city partners, and all of those in San Francisco who care so deeply about people experiencing homelessness during this crisis. HSH and our nonprofit partners hear you, and we appreciate your care and concern. This reminds us day in and day out that housing is healthcare and that relationships are the best form of treatment. Those without these suffer the most. To date, 3 shelter guests have tested positive for COVID-19, 2 at MSC South and 1 at Division Circle. The Department of Public Health and HSH have established the following protocol for positive cases within shelters, which have been implemented in response to both sites. First, supplying the shelter with additional masks, and that all shelter guests and staff wear masks at all times. This is advice being given to all of our shelter sites as we speak. The Department of Public Health initiated contact tracing for these patients when they came into contact with them. This allows us to understand who at the shelter and in the rest of the community positive individuals have come into contact with. This is the same process that happens with housed and unhoused neighbors who test positive for COVID. The Department of Public Health is deploying a physician and health workers to the shelter site to conduct symptoms and deep temperature screening for all guests and staff. Any guest demonstrating symptoms for COVID-19 will be tested and relocated to the staff isolation rooms. Guests considered close contacts will also be relocated to quarantine hotel rooms. Other high-risk guests, including those over the age of 60 and those with pre-existing conditions, will be placed in hotel rooms to shelter in place. Staff at the shelter will also be provided medical support and space to quarantine or isolate as first responders. We're grateful to our system of care for viewing our nonprofit and city workers who work with the homeless population as first responders. The city is deploying a professional cleaning crew on site to thoroughly disinfect the shelter, and the Department of Public Health will be on site to answer staff and guest questions. The site management will continue to guide social distancing protocols and implement shelter health screening protocols. As more individuals move off site, that social distancing will be accomplished. Director Rohr also spoke about social distancing now moving to be focused in hotels. Top priorities for the use of the hotel rooms are to provide quarantine and isolation rooms for COVID-positive people or people awaiting test results living in congregate settings, and to provide shelter-in-place rooms for high-risk populations for people experiencing homelessness. HSH has opened a hotel to provide shelter in place for high-risk people experiencing homelessness in our existing shelter system. This new capacity, brought online very rapidly, will allow for greater physical distancing at existing shelters and will protect the health of seniors and people with pre-existing conditions in our shelter system. Now the challenge is scale. HSH, in partnership with HSA, plans to continue to expand the use of hotel rooms for shelter in place for people experiencing homelessness who are both sheltered and unsheltered. There are many factors that go into opening hotel rooms that include hotel staffing, meals, transportation, security, cleaning. And I want to thank our partners at HSA, the Department of Public Health, the Emergency Operations Center run by the Department of Emergency Management, and the nonprofit community for helping us move forward as rapidly as possible. Thank you. I'm now going to introduce Jeff Tumlin, who's the Director of MTA.
We'll deal with that next time. Hello, my name is Jeffrey Tumlin. As a lifelong advocate of transit and as the director of the SFMTA, I never thought I would say this. But please, if you have any other option for getting around, please do not ride Muni. For the duration of the public health emergency, Muni is only for delivering essential workers to work and for allowing San Franciscans to access essential services. If you need to get around for some other purpose, please find another way. If you have the ability to drive or walk or ride a bicycle, please choose those modes in order to ensure that there is adequate space available on our Muni buses for the people who need it the most. Many of our bus operators are in specific vulnerable population categories, and as a result, they are needing to shelter in place in accordance with the public health order. As a result, over the coming weeks, we are expecting about 30 to 40% of our bus operators to not be able to show up to work. As of last week, although our ridership is down by over 80%, we are still carrying about 100,000 passengers a day. And as a result of that, we're experiencing significant crowding on some of our key lines like the 14, the 38, the 8, and the 9. We have right now, during the public health crisis, two essential priorities at Muni. One is protecting the health and safety of our operators, and two is protecting the health and safety of our passengers who are essential workers keeping the city running. In order to meet those priorities and address the fact that service is in decline, it would be terrible for us to simply cut 30% of our service across the board. That would result in extreme crowding on the most important lines. And so as a result of that, we've made the very painful choice to, instead of doing across-the-board service cuts, to streamline our service into an essential network. What this means is taking the 15 highest ridership lines and beefing up service on those lines in order for our passengers to maintain essential distance, and as a result of that, cutting all of our low ridership lines. We did not do this work lightly. We looked very carefully at all of the data of where our ridership is segment by segment and where we're experiencing crowding. We also looked at locations of essential services all over San Francisco, whether that's hospitals or important neighborhood commercial districts or supermarkets. We then applied the Muni equity strategy, making sure that we were adding extra service to neighborhoods where there are people who have the fewest choices. The result is a map of 15 lines plus 2 rapid lines that serve every neighborhood and put all San Franciscans within a mile of a bus stop and most San Franciscans within a half mile of a bus stop. The cuts are painful in every single neighborhood. And if the response that we've gotten from the public is any indication of success, we've made everyone equally unhappy. It is terribly painful for me to do this. And we're working quickly on ways in which we can provide additional subsidized taxi service and paratransit service to parts of the city where we've had to make the deepest cuts. These changes are going to be rolling out starting tomorrow. Tuesday, we'll be losing about a half a dozen lines, and then we'll go fully into effect on Wednesday. We are making these changes up as we go along in response to the rapidly changing conditions as a result of the health emergency. So I urge you to be patient. I urge you especially to be patient with our operators. Please feel free to be upset at me for being late for work or for a longer walk to your bus stop, but recognize that your bus operators are frontline workers. They are accepting some level of risk in order to keep this system running and in order to deliver essential workers to work. Please thank them. They are heroes here in San Francisco, and I could not be more proud to work for them and to be advocating on their behalf. As always, please keep up with the details on our website. They will be rapidly changing. Our website is sfmta.com/COVID for all of the latest updates as we move along. Now, I'd like to turn the stage over to the San Francisco Police Department's Chief Bill Scott. Thank you.
Good afternoon. So I'd like to start this afternoon's message with an update of what happened over the weekend by way of social distancing and our public health orders. Overall, we saw a lot of good social distancing over this weekend. The rain probably helped, as many people were not outside who probably would have otherwise been outside. However, those that were, we saw very good cooperation with our public health orders and our social distancing. Our crowds were pretty light across the city. In places that normally are populated with people, they were not out this weekend for the most part. There did not seem to be a lot of people downtown, areas of the Mission District that we've had some challenges in, areas in other parts of the city. It was just probably because of the rain, but nonetheless, the news was good overall. We still have some challenges in certain parts of the city, in the Tenderloin and other districts where we have unsheltered and unhoused people. We're still working with that population, particularly with the education piece and working with the Departments of Homelessness and Supportive Housing and the Human Services Agency to try to rectify some of the challenges that we see there. So that work is ongoing. Over the weekend, we have basically stepped up our patrols as we have talked about since this public health order started. So hopefully you are seeing, as I have, many officers on the streets and on foot, particularly in the areas where we're trying to spread the message and educate the public to social distance and stay 6 feet apart. I'm going to give you the statistics, and we're in the process of updating what occurred over the weekend. So these statistics are actually good as of this past Friday. We still have 2 citations confirmed, and I want to correct information that I put out last week or last Friday that one of those citations was for a business. That business was actually warned and admonished and closed, so it was not cited. But to date, we have 2 citations of 2 individuals. There have been 26 total warnings or admonishments. 22 of those were with persons who were not found to be social distancing, and 4 were with non-essential businesses. And as we have said over and over again, this is a matter of life and death, so we're asking that the public please comply with these public health orders. Stay at home, And if you have to go out for an essential item or essential shopping, please be smart about it. In terms of our crime statistics, we are still seeing decreases in crime when compared to the prior week. Last week, we saw a 24% decrease in violent crime. We saw a 32% decrease in property crime and an overall Part 1 crime decrease of 31%. And that was comparing the weeks of March 23rd through the 30th. We've seen some burglaries and vandalisms of businesses. So again, our officers are out. They're going to be paying close attention to businesses that have closed to make sure that we can do what we can to not allow that to be a trend that our business owners have to deal with. We're focusing on portions of the city to safeguard boarded up businesses. And so far, the owners who are sheltering in place, we don't want them to have to worry about their businesses. So we will be out and in full force for that. We are encouraging the public to continue to report crimes when they see them. If it's a violent crime, please call 911 and we will respond as we always do. If it's a property crime or a crime of a nonviolent nature, particularly those crimes that have already occurred, please call our non-emergency number, 415-553-0123. You can also call 311 or utilize our website to file a police report or request an existing police report if you need a copy of it. We also want to alert the public to be aware of scams. We're seeing a lot on social media about people knocking on doors in residential communities, pretending to be city workers or public health workers or the Center for Disease Control workers. We've also heard information that some people are issuing masks. Those are not city workers. Those are not CDC workers, nor are those folks public health workers. So if someone knocks at your door in a residential area, please don't open it. Don't let them in. Do not accept a mask. Call 911. We don't want anybody to be taken advantage of, and we know that even in times as unfortunate as what we're facing right now, there are people out there that will take advantage or who will take advantage of other people, and we don't want that to happen to anybody. So please do not let anyone in your home. The city is not sending workers to issue masks, nor are we sending workers to residential areas to inspect homes. So if you do get a knock on your door regarding that, it is not a righteous person that's doing that. So call 911. I also want to update on hate crimes. There's been a lot of talk about whether or not hate crimes have gone up in our city, particularly hate crimes against members of our Asian community. We have not seen that trend, and what we ask is that if you are the victim of a hate crime, please call the police, call us. Just to illustrate the trends that we are seeing, I'm going to talk about the last 4 years of hate crimes. Year to date, 2017, we had a total of 7. 2018, we had a total of 4. 2019, we had a total of 6. And this year, year to date, we've had a total of 5. And this is specifically hate crimes against members of our Asian community. So we have not seen an increase, but that is not to say that these things are not occurring. What we ask the public is to please report hate crimes if they are occurring. These type of crimes are unacceptable at any time, and particularly during this public health crisis and this pandemic. So please report that immediately if that has happened to you. Lastly, I will end on a note of the same messaging as the mayor and the other city leaders that have spoken to you. We really need the public's support and help on social distancing, staying at home. Please do not go out if you don't have to. We know that this will save lives, and we need the public support. We will continue, the San Francisco Police Department, to be out there in force to do our jobs. And again, as I stated, those that have been warned will be cited if we have to go back and warn them again or deal with that situation again. So with that, I know we will open it up for questions.
Chief Scott, we'll start with you.
Okay, thank you.
First question from Melanie at KGO. Is San Francisco considering implementing a curfew, and if so, could you provide details?
No, a curfew has not been discussed at this time. We are very comfortable with the public health orders that the mayor has and the director of public health has issued, and we believe that if we have some success with that, there's no need for curfew. So that is not on the table at this time.
And a follow-up. Exactly how many citations have been issued at this point to businesses or individuals, and specifically to whom were they issued and for what exactly?
2 citations, both to individuals. As I said, the information this past Friday about the business was incorrect. Those 2 citations were both to individuals. I don't have their names, but they were both individuals, and they were in violation of the public health order, social distancing type of issues.
Thank you. Question for you from Michael Barbara of the San Francisco Examiner. What were the circumstances of the 2 shelter-in-place citations issued by SFPD so far? And to follow on that, do you believe the district attorney should file charges stemming from the citations your officers have issued?
Let me answer the second part first. I've had conversations with our district attorney about the public health orders, and I will say that he has been extremely supportive. We've talked specifically about the need to, if the need arises, he is supportive. I don't have those cases in terms of the details to discuss the merits of either of those cases, so I don't think that's appropriate for me to go into details that I don't have. But I will say they were both of the public health order violation nature, and those eventually will make its way to the proper authorities, the proper prosecutor, and we'll see what happens.
Thank you. The next questions are for Dr. Grant Colfax.
Thank you.
It's okay. Dr. Colfax, the first question is from Kate Wolf of KQED. Is the San Francisco Medical Examiner's Office testing for COVID-19 in people who have died?
So the medical examiner is following CDC guidelines with regard to testing for COVID-19 in people who have died. That would include people who die suddenly, who have a known contact with somebody who's COVID positive.
Thank you. Follow-up question. Have there been any fatalities involving people that were not tested while they were alive?
I am aware of at least one case where the deceased was tested after unfortunately passing away, and that person had a close contact with a COVID positive case.
Question from Tricia Tondandi of the San Francisco Chronicle. Why has the Department of Public Health decided to retest patients and staff in South 5 and 4 at Laguna Honda?
So as we have investigated the outbreak at Laguna Honda Hospital, let me emphasize again that we have some of the very best people in the nation, if not in the world, helping us with this investigation, physicians from the Centers for Disease Control. And since they arrived here starting a week ago last Sunday, they have done an outstanding job and a very thoughtful and careful job of looking at the outbreak in 5S and 4S. And they, based on the people who have already tested positive, the staff and the patients at 5S, they have made this recommendation. And with regard to 4S, they have made the recommendation to expand our testing there. I also want to emphasize that of the patients at Laguna Honda, the positive patients have been concentrated in the 5 South neighborhood.
And a follow-up to that, what condition are the 16 infected people from Laguna Honda in, and have any been transferred to San Francisco General Hospital?
So of the 16, 14 are in good condition, 2 are in fair condition and have been transferred to more acute hospitals. I will say that over the past few days, there was one patient who was transferred to Zuckerberg Hospital, thankfully stabilized, and then was returned to quarantine at Laguna Honda Hospital.
Question from Joshua Sabatini of the San Francisco Examiner. Does the Department of Public Health plan to move any patients from Laguna Honda Hospital into hotel rooms, or has that been placed on hold given the outbreak?
We are continuing to explore that and are seeking the advice of our CDC colleagues with regard to moving that forward. I want to emphasize that from the beginning, that was a small group of patients numbering no more than approximately between 20 and 30.
And a follow-up from Josh Sabatini. Do you have any details on how COVID-19 was introduced to Laguna Honda?
So I think when we look at how COVID-19 has generally been introduced into skilled nursing facilities and other similar facilities across the country, despite multiple efforts to prevent and to slow the spread. Unfortunately, one of the key factors is that people who work at the facility, despite their own efforts and others, unintentionally appear to be the source in many of these cases, if not all of these cases. And again, right now we are working to ensure that staff are following all proper disease control procedures, including greatly reducing risk of transmission through masking, personal protective equipment wherever required. And again, the CDC is working very hard to ensure not only are these recommendations being applied, but they're also being adhered to. And I just really want to express my deep gratitude to the staff at Laguna Honda, from the chief, from the leadership, managers, but especially the people on the front lines who are taking care of patients every day. They are doing incredible work, and I think that all of us owe them a huge debt of gratitude in their work in taking care of people every day. This work is always challenging, even without coronavirus. They are some of my personal heroes, and more so than ever during this pandemic.
Thank you, Dr. Colfax. The next questions are for Abigail Stewart-Kahn. First question is from Janie Har of the Associated Press. To date, how many people experiencing homelessness have tested positive for COVID?
Thank you for that question. I'm only aware of individuals who've tested positive at sites in the homelessness response system. It's a large system of care where people experiencing homelessness touch many different aspects. In the homelessness response system to date, there are only 3 who have tested positive for COVID. Those are the individuals I discussed earlier.
And a follow-up to that, where are they now, those 3 individuals?
Yeah, those 3 individuals are in good condition and are either receiving medical care or at an isolation quarantine site operated by Human Services Agency and staffed by the Department of Public Health.
Thank you. Question from John King of the San Francisco Chronicle. What is the status of the vehicle triage center on Geneva?
Right. For those who are unfamiliar, we have a pilot project that allows people who live in their vehicles to come inside and receive access to our system as they work to end their homelessness. As of late last week, there were 25 vehicles on site, which is essentially full for us. And we have pivoted, as we've pivoted our entire homelessness response system, to be addressing that in the context of COVID. So there's more food being delivered on site, there's more health screening available, and people are receiving the education they need to follow all of the social distancing guidance.
And a follow-up to that, how many RVs are in place, and is the ramping up on schedule for the RV sites?
For future sites, John, I will assume you mean your future question. So it's on schedule for the pilot. It's working really, really well, and we've learned a tremendous amount, and I was very pleased to speak at a hearing about it, coordinated by Supervisor Safai's office. Feels like a long time ago now, honestly. And I think we need to look at everything going forward in the context of what the coronavirus will do to the city's response system, to the city's budget, as the mayor has discussed. And so we've looked at every aspect of our system and what is planned for expansion, and we're continuing to evaluate that on a case-by-case basis.
Final question from Brian Howie of San Francisco Public Press. Does the city plan to place into hotel rooms unhoused people who do not belong to vulnerable populations or have not been exposed or tested positive for coronavirus?
That's a great question, Brian. Thank you. And again, for all of you who care so much about our unhoused, particularly our unsheltered and sheltered neighbors living in congregate settings. As I've said, the priority for the city is to move people out of out of hospitals, and then also out of congregate settings, and to look for the vulnerable, people who are vulnerable to COVID-19 who are living on our streets. That is a significant portion of our unsheltered population, and we'll be working to include them in hotel rooms first, and then we will continue to evaluate the situation.
And a follow-up to that, where will those currently in Moscone who are not post-COVID or tested negative be moved?
Thank you for that question, I understand now. Those who are currently at Moscone West who moved there as part of early shelter thinning, as opposed to the adjustments that we've been making over the last couple of days, those individuals are being relocated to hotel rooms operated by the Human Services Agency and staffed by the Department of Homelessness and Supportive Housing and our partners.
Thank you. That concludes our press conference.